An effective treatment for pimples. Salicylic acid primarily functions as a keratolytic agent, meaning it aids in the shedding of dead skin cells. It penetrates the pores, exfoliates the skin's surface, and helps unclog congested pores. By removing dead skin cells and excess sebum, it prevents the formation of comedones, blackheads, and whiteheads, reducing the likelihood of acne breakouts. Furthermore, salicylic acid possesses anti-inflammatory properties, reducing redness and swelling associated with pimples lesions. It also helps to inhibit the growth of acne-causing bacteria, making it an excellent choice for treating mild to moderate pimples. Incorporating salicylic acid into your skincare routine. Salicylic acid can be used along with any of the following but with precautions. 1. Cleanser. Start by selecting a salicylic acid-based cleanser suitable for your skin type. It is advisable to choose a product with a concentration between 0.5% and 2%. Use the cleanser twice daily, gently massaging it onto damp skin for about 30 seconds before rinsing thoroughly. 2. Skin toner. If you prefer to use a toner, opt for an alcohol-free formula containing salicylic acid. Apply it after cleansing to further remove impurities and excess oil. Pour a small amount onto a cotton pad and gently swipe it across your face. Allow the toner to dry completely before proceeding with the next step. 3. Spot treatment. For targeted treatment of individual acne blemishes, consider using a salicylic acid spot treatment. Apply a small amount directly onto the affected area, ensuring it is absorbed into the skin. Allow it to dry completely before continuing with the rest of your skincare routine. 4. Exfoliation. Incorporate a salicylic acid-based exfoliant into your weekly routine to remove dead skin cells more thoroughly. Choose a product with a concentration of 1% to 2% and use it 1 minute 2 times a week. Gently massage the exfoliant onto damp skin, focusing on areas prone to breakouts. Rinse thoroughly and follow with a moisturizer. 5. Moisturizer and sunscreen. Since salicylic acid can be drying, it is crucial to use a moisturizer suited to your skin type after each application. Look for a lightweight, non-comedogenic moisturizer to keep your skin hydrated without clogging pores. Additionally, it is vital to apply sunscreen with at least sun protection factor of 30 during the day to protect your skin from potential sun damage and prevent post-inflammatory hyperpigmentation. Important considerations. While salicylic acid is generally safe for most people, it's essential to be aware of a few precautions. 1. Patch test. Before incorporating salicylic acid into your routine, perform a patch test to ensure you don't experience any adverse reactions. Apply a small amount of the product to a discrete area of your skin and observe for 24 hours. 2. Gradual introduction. Start by using salicylic acid products once every other day or a few times a week to allow your skin to adjust. Gradually increase the frequency of use as tolerated. 3. Avoid overuse. Excessive use of salicylic acid can lead to skin irritation and dryness. Follow the recommended instructions on the product label and do not use more than necessary. 4. Consult a dermatologist. If you have severe acne or are unsure about using salicylic acid, consult a dermatologist who can provide personalized advice and recommend suitable treatments. Using salicylic acid for pimples treatment. 1. Choose the right product. Salicylic acid is available in various forms, including cleansers, toners, serums, and spot treatments. Start by selecting a product suitable for your skin type and the severity of your acne. It is generally advisable to begin with a lower concentration and gradually increase if needed. 2. Cleanse your skin. Before applying any salicylic acid product, cleanse your face thoroughly with a gentle cleanser to remove dirt, excess oil, and makeup. Pat your skin dry with a clean towel. 3. Apply the product. Follow the instructions provided with the specific salicylic acid product you have chosen. Typically, you will apply a small amount to the affected areas or your entire face, avoiding the delicate eye area. Gently massage the product into your skin using circular motions. 4. Start slowly. If you are new to salicylic acid, it is advisable to start using it once a day, preferably in the evening, to allow your skin to adjust. Over time, you can gradually increase the frequency of use, up to twice daily, if your skin tolerates it well. 5. Moisturize and protect. Salicylic acid can cause mild dryness or peeling, especially during the initial stages of treatment. To counteract this, moisturize your skin with a non-comedogenic moisturizer. Additionally, always apply a broad-spectrum sunscreen with a sun protection factor of 30 or higher during the day to protect your skin from harmful UV rays. 6. Be patient. Results may not be immediate, and it often takes several weeks of consistent use to see significant improvements. Remember, acne is a complex condition, and it requires time and patience for any treatment to show its full effects. 7. Consult a dermatologist. If you have severe acne or if salicylic acid does not provide the desired results, it is recommended to seek professional advice from a dermatologist. They can assess your skin condition and recommend alternative treatments or a higher concentration of salicylic acid if necessary. Conclusion: salicylic acid has earned its reputation as a reliable and effective treatment for acne. By exfoliating the skin, unclogging pores, and reducing inflammation, it tackles the underlying causes of acne breakouts. When used correctly and consistently, salicylic acid can be a valuable addition to your skincare routine, helping you achieve a clearer, healthier complexion. Remember to start with lower concentrations, be patient, and consult a dermatologist if needed. If you want to know about other anti-pimples remedies, subscribe to our channel so that you will be notified when our next video on another anti-pimples cream is out. Note that knowledge is advancing by the day, and we will like to always post an update on new advances on how to stay healthy. You can contact us via the link in the description below for any medical inquiry. You are watching Zoom Hospital channel and listening to work of Dr. Kayode.